Happy Friday, everybody. Welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, is skinny culture back? There's an article out there claiming it is and what that might mean. And then, does Semaglutide or Ozempic actually reverse arthritis? There's a new research paper out that has some pretty crazy results. This one's actually kind of big. And then finally, another plastic surgery death, this time in Brazil. What caused it? We're going to try to figure that out, look at the data, and see if we can come to a conclusion. I'm your host, plastic surgeon Dr. Bruce Hermann, and with me is Kalee Dion Pear. As always, looking very awesome. I always love your outfits.
Thanks.
You have the best outfits. Yeah?
The runway.
Oh, what is it?
Yeah.
Oh, what is it called?
Rent the runway.
Rent the runway. Yes, you told me about that.
Love
yeah.
it. I love it. Different outfit. Send them back. Get another one the next day.
Listen, do they have that for men?
They do, and it's also like, remember when you had the DVDs with Netflix and you could get them back?
Yeah.
It's faster than that.
Is
so
it really?
I leave it out on my porch in a bag. They come and pick it up, and
That's
then they
pretty
drop it off. It's amazing.
I'm gonna have to look. I really love clothes. I always wear scrubs on here just because I feel it's like the doctor. I'm the doctor. I gotta at least.
You got it easy.
I gotta kind of look the part. But I love clothes. Man, that's something I'm actually.
I can use it for vacations. I can use it for. The only problem is like I'm a little small. So like
right, yeah. So they're not altered.
Yeah, but that's
altered.
okay. I don't mind.
Yeah, no, it looks great.
I'm rolling with it.
Looks great. All right, Brenna, what's up in the box? You in there?
Yes. Sorry, I clicked the wrong.
So I'm off, leaving to go skiing.
Woohoo.
Well, I don't ski, I snowboard. Are you guys winter people? Do you do the skiing, snowboarding?
I've never skied, but
You've never skied?
Yeah,
used to
no.
ski.
My boyfriend's a big skier. They just went to Switzerland this Christmas.
Well, he doesn't take
Go to
you?
Switzerland.
Not yet. I know he's going to, but I'm scared.
Are you scared?
Oh, don't be scared. Dude, we actually, remember we just did the segment a couple weeks ago about skiing and how it's like safer than driving.
Yeah, I've never skied with my family. I've never.
Really?
Yeah. So, I went to Chicago last month, in January, and that was the coldest I've ever experienced. So.
Oh, because you just hadn't traveled up north a whole lot?
Yeah,
Yeah.
I just haven't been in like.
You got to go to Colorado. You've never been to
I
Colorado?
know. Yeah, I haven't.
Oh my God, you have to go. We're going to Denver actually.
That's so awesome.
In a day, and we leave Saturday, and so we go every year. We have for the past 5 or 6 years. My brother lives in Denver.
Oh, cool.
Now let me just tell you, skiing's expensive, but we have like a hack for it.
Mm-hmm.
So one, we don't stay on the mountain. We stay at my brother's house, which I know obviously everyone doesn't have a brother that lives in Denver, but
Yeah.
that helps a lot. And then the other thing we do, because lift tickets are insanely expensive.
They're so expensive.
They're crazy. Like the one year that we went and we didn't do what I'm about to tell you, they were like $300 a person a day.
Oh my gosh.
So like a family of 4, that's like $1,200.
Yeah.
So you can actually buy them in the summer for the upcoming year, and so like it ends up being like $60 a day.
That's pretty good.
Yeah, it's super cheap. But then you're kind of locked into a certain mountain, and you're like, okay, you have to go. But so yeah, we kind of go on a budget, which is I don't know.
I grew up going in Wisconsin.
There's mountains in Wisconsin?
There's not.
Oh, okay.
Unless you're watching Christmas Vacation, where they go get the tree, and it always shows a mountain, and there's no mountains in Illinois. Okay, there's none.
Right.
Jonathan,
Yeah, I
my
was like,
husband,
that's-
he
didn't know
will
that.
say every time, cue Kalee saying that there's no mountains in Illinois. But anyway, so there's hills in Wisconsin. So there's skiing in Wisconsin.
Okay.
And so I always was like,
It's like
hey,
gives you a
I
taste.
can do the double black. Like, I went with like my best friend from college and her family all the time. And then I went to Montana when I was trying to make my family a ski family, which we are not going to be ski family.
Oh, you're not?
Okay, because I don't like being cold.
I don't like being cold. That's why you go in the spring.
Well, yeah. So we went to Montana in the spring and it worked out.
Okay.
But I went to the top of the mountain because there was a bar up there. And I was like, I got this. Like, I've done the double black. Like, I can do this. And then...
I love it. And what was it, all blacks going down?
I don't remember. I blacked out. It took 45 minutes. My legs hurt so bad. I did not fall.
Hey,
but
there you go.
I didn't breathe
Right.
the entire
You're just
way
like
down.
white
And I just
knuckling
went,
it down the mountain. Yeah.
I was like, you know what? I'm good if I honestly never do that again.
Yeah. I've skied and I actually snowboard now, and I've been going forever. And so I can do anything. I can do a double black. I just don't like it. It's too much work. I don't want to work that.
It is work.
I don't
and I
want to
think
work
that's
that
why-
hard. Plus, your legs get destroyed if you're like doing something like that.
Yes.
So I these days, like, I'm cool with greens and blues, and my kids will drag me on the blacks every now and then. I'm like, yeah, I'll do one. But I don't know if it's 'cause I'm old or what. I'm just like, I don't want to work that hard. I just want to like have a good time.
Yes, I want to go to the
Yeah.
beach and I want to have a drink in my hand.
That
I
is
want
fun
to sit at
too.
the pool bar.
I do. I love the beach. Like
That's-
we are kind of like beach and mountain people. We
Yeah.
try to alternate. We always do skiing, snowboarding in the spring, and then in the summer we'll go to the beach. But,
Yeah.
So all right, well, we're off. Hopefully I make it back.
Yeah, no, you
Although-
will. I'm excited to hear how it goes.
Yeah. All right.
I'll just be here, living it up in North Texas.
Hey man, this is the place. Everybody's moving here. Okay, all right. I love talking about trends just because I think they're interesting. Like I always kind of get into the science of like why do things happen, and we've had a lot of body preference trends kind of rotate through lately. For a long time it was the Kardashian body, right? Then recently, in the past couple years, the ballet body. I think we did a segment about that a year or two ago.
Mm-hmm.
But now there's an article saying that it's changed again, and that skinny culture is back. Extra credit. Who is that on the screen?
She's a model, right?
Yep.
Dang.
Blanking.
I can't remember her name. I actually don't know pop culture, period.
So she's an older model. Like this is me showing my age. That's Kate Moss. She was
Kate
like,
Moss, yeah.
yeah, she
See, I
was
don't know
like
names,
the
so I-
absolute superstar model of the 1990s, the heroin chic look. I mean, she was like, I think her BMI was like 15 or something, which is insanely
That's
low.
ridiculous.
Yeah, everyone was like, oh my God, that girl's so thin. I always loved Kate Moss. I mean, I'm not advocating that people should look like this, but I just thought Kate Moss was cool. Like, you always see her like freaking smoking a cigarette, like
Yeah.
she's not like the models today that are all like prim and proper, like she's like dragging a cig at the local bar. I'm like, I love that girl. Anyway, okay, so I also want to show a picture of the article if people want to look this up. I didn't just make this up for content. This is why skinny culture. This actually came out of like the University of Colorado somewhere. Like I probably should have looked up exact. It was some media outlet related to Colorado. I think it was UC actually. But anyway, so why skinny culture's back, what it means for body image and mental health. All right, so first off, I'm asking you guys questions. I love asking you guys questions. I know what you guys can tell me. Do you think this is true? Like, is this a real thing? Like, do we think this is because like recently the trend was ballet body, which is thinner than Kardashian, but more like the athletic look is like what people are saying the current trend is. It's like, yeah, I can buy that. What do you think? Is skinny back?
I feel like it is.
I feel like we're still in the middle of the skinny and the fit.
You still think it's still ballet?
Yeah, and I also think it depends.
I don't know. Like I would have never said that. I was like, yeah, it's the ballet body right now. But then, like, I mean, how many segments have we done on people that just look so skinny? And it's like, these are like celebrities out there looking like this. And that does influence trends. I mean,
You're right. I don't want it to influence trends because that
but it
is
does.
not
I mean,
it.
yeah.
It's,
Yeah, so, and to be fair, another thing is that, I mean, the skinny body is not like a huge leap from ballet body.
Yeah,
It'd be
it's
one
not.
thing if we were in the middle of the Kardashian body, and suddenly somebody's saying, oh, it's skinny all of a sudden. I'm like, it is? I haven't seen that. But, I have seen a lot of really skinny people out there. And this is not the first time skinny's been around. It's been around like basically 4 times in the last 100 years. There was the flappers in the 20s. They were super skinny. You guys heard Twiggy?
yes.
It's in the 60s. Then there was I like to call it the heroin chic of the 90s. And now it's kind of, so how many years? That's 40, 30, and then 30. Like that's kind of on trend, like for times in between. And it's kind of funny how these body trends, it's like there's 3 trends. There's curvy, athletic, and skinny. And it's just like they all kind of rotate.
Yeah.
It's like people will do it for a while and then they get bored of it and then they go on to something different. But, one of the things that I found when I was doing research on that, have you guys heard of skinny talk?
It just sounds like it's like
Is it a podcast?
No,
skinny
so
TikTok.
see, so Brenda, like you at least maybe know what I'm talking about when I say skinny talk.
Yes.
Is it like the Secret Lives of Mormon Wives?
So it's basically, I don't want to call it like an area of TikTok, but it's a timeline of TikTok. Because so my timeline on social media is like medical
plastic
and
surgery.
news, right? Plastic surgery, right? So there's what's the the right way? I don't want to say timeline, but like feed.
Feed.
Okay, so a feed of TikTok that's all promoting extreme thinness, restrictive eating, like crazy workout routines. I I didn't know this was a thing. Like, I try not to get on TikTok, even though I have the most followers
I
on
wanna
TikTok
get that feed.
of any platform. I have the most followers on TikTok, and I almost never get on there. I hadn't heard about this one. I almost think this deserves its own segment.
Yeah, I
On
think we
Skinny
should.
Talk.
I want to go to this feed.
Because I don't think that Skinny Talk is probably healthy, you know? I mean, if it's like glorifying looking like you're unwell.
I think it depends on what they're saying in those videos.
Yeah, I agree. You're right. I shouldn't just jump to that conclusion.
Yeah, I have this one girl I think that like would fall under this category. I think her name's like Brooke Moly, Moly. I don't know how to say it, but she's like a really like aggressive, like kind of like a bullying you into being like you're
right.
really gonna eat Taco Bell. It's like, and it's just like, why? It's not worth it. Like the taste for 5 seconds. Eat something that's not good, but it's gonna benefit you. But
Yeah.
I don't know. She's just really mean about it. I'm like,
Oh well, yeah, we don't want that.
That brings
We
up
don't
a
want
great
that.
point.
It's really aggressive.
Of that, and a lot of people are really like don't care for Skinny Talk because it's almost, you know, like bullying people into like, this is what you're gonna do, or you're just like a worthless person. You know what I mean?
Yeah, well, I don't like that.
Yeah, I don't like that. I'm gonna look into Skinny Talk. We're not gonna let that one die. That's,
We need to look into
that's
this
gonna
more.
cut. We're gonna
I don't
investigate.
want to assume that that's
Yeah, I don't want to
the whole
assume it's
feed.
bad. It could be, there might be, it's like anything. There's probably good parts of it. Like, hey, do you want to be more fit? Like, follow these. And that maybe fall into Skinny Talk. But I don't know. I feel like Skinny Talk's a little bit more militant than that. It's more like,
Yeah.
you're going to be skinny or you're a bad person. I don't know. I'm just making this up. I don't know. We're going to get to the bottom of that. But I mean, I guess, you know, the next
And
big...
what is skinny?
Right, exactly. What's the definition of skinny? You know, is there a definition? I mean, I could come up with a definition. I would
Yeah.
use like BMI probably.
But BMI is so off.
It's off, but
According
it's
to BMI, I'm obese.
it's off going the
No
other
joke.
direction.
I'm
It tends
obese.
to. I think it's more off when you're looking at, does it overestimate someone being heavy? I'm not sure it does go in the other direction. And the reason is, and this is easy explanation, because muscle dramatically affects BMI. And so you can have somebody, like when I used, believe it or not, I know I don't look like it, I actually really was into weightlifting for a while.
Yeah, so was that.
And so when I was at my most like heavy, and I don't mean heavy like fat, I mean heavy like I was like muscly, like I was 5'9", like 170. Like right now I'm like 5'9", 153. I was like basically 20 pounds of muscle, and I was overweight, but I looked ripped. Like my body fat percentage was nothing because I was just in a crazy workout. And so, and I'm not saying that to make it about me. I'm just saying that, you know, if you are muscly, like you work out, like your BMI is skewed.
Yeah.
But I don't think
So
it
you're not
goes the
saying
other
obese.
direction. What?
So you're not saying I'm obese.
No, obviously
I'm just
not.
kidding.
Like
I'm
you're,
just kidding.
like you're obviously very fit, and I assume you work. I know you work out. You play tennis all the time,
Yeah.
and you know what
And I
muscles?
do lift.
What muscles are really big and get heavy are your quads
I have
and your
big,
glutes.
I have big legs.
Totally,
I do have
man.
big legs.
Totally. Like you are.
Softball. I played softball growing up, so I have some big thighs.
There you
legs.
go. And I used to be a sprinter, and so you know I actually have kind of like, you know, for my frame, like kind of a thicker
Yeah.
mid to lower region, not because I'm heavy, because I, you know, used to like run like a crazy person and work out. I forgot where I was. Oh, right. So
We're just making each other feel better. It's really great, actually.
you're a great
You guys-
person.
you
You're
guys
so
should join
nice.
it.
You're,
Brenna, if
you
you want
look
to do
great.
this
You
too.
look awesome.
I really
Brittany,
needed
you look
this
awesome
today.
too. Everyone's awesome.
I just started hot Pilates. Oops.
Oh.
Why is my echo? I just started doing hot Pilates classes.
Oh,
and
nice.
That's
yeah,
great.
it's
Good
killing
for
me.
you.
But
Good for you.
Thank
All right.
you.
It does. You bring up an excellent point, Kalee, about BMI being off. I'm not sure it works the other way though.
Yeah.
Like if your BMI is really low, you're skinny.
Yeah.
Yeah. Okay.
Yeah.
All right. That's all I'm saying. Okay. So how big is an influence is social media on these changing trends? All right. On a scale of 1 to 10, how big is an influence? I like the 1 to 10s lately.
I like
I'm
that
bringing
too.
I'm bringing them the 1 to 10 back. On a scale of 1 to 10, how big of an influence is social media on body trends? Brenna, go first.
I mean, this is an easy
I think
one.
it's a lot.
10.
10. Yeah.
10. Oh, you can go all the way to 10. You can say 10 too.
Well, yeah, it's kind of like our generation was like the WB and like, you know,
Yeah.
TV and like the,
Yeah.
the actors that were on
Yeah.
TV. Like that's kind of what we. Now that's that for now. Kids want to be a YouTuber.
Yeah,
or they wanna be on social
I
media.
was gonna say 9, but I can buy 10. Like
Yeah.
it is the
It's
biggest
100%.
influence, hands down. All right,
Yeah.
and again, this question's obvious, but we should bring it up. Are certain people more at risk of being influenced by these trends?
Oh yeah. Yes.
I think so.
Of course,
Oh,
it's
yeah.
young people, right?
Young people.
Yeah, young people are definitely. I mean, I don't know. I always I almost thought that my daughter's generation might be kind of like a circle back to Gen X because you're a millennial, right?
I'm a geriatric millennial.
You're like in the older
technically.
millennial.
Yeah.
Like if I could say
Geriatric.
one thing about my Gen X generation is that we're extremely skeptical. Like we don't believe anything. Like you can show us something, nah, that's not true. That's why we're hard to scam. Like someone comes up to me and it's like, it's a scam. It's a scam.
Yeah.
Like I feel
like I'm like
the
that.
Texas Medical Board called my house one time. Now, not for a bad reason. And I basically told them, I was like, dude, why are you trying to scam me? You know what I mean? Like, I know this is not, and they're like, no, really, this is, I was like, yeah, you're going to call my house? Like,
Yeah,
I was
no.
like, BS. And it was. But anyway, but I almost thought, like, I don't know, like, I see my daughter's friends and her, and I was like, I kind of think skepticism is coming back, and it kind of makes me excited, But yeah, so I mean, but in general, young people are very susceptible to this, and the whole skepticism thing was to say that I see celebrities tell me to do something, I'm gonna do the exact opposite, right? And that's not always been the case.
Amen.
Yeah, that's not always been the case. Now this is the big question, and again, obvious answer: how big of an influence do you think Ozempic and the GLP-1s have been in bringing back the skinny trend, if you think that the skinny trend is actually here?
I feel like a lot.
A lot.
Like the Super Bowl commercials this year were
Yeah.
all about losing weight.
That's all the
And-
commercials now.
Yeah.
know,
And in general,
right?
but I was just like the Super Bowl. I was like, wow, they have a lot of income paying for this
like-
many of these commercials.
I do buy into it because it's not just, it's more about health for me. It's not about like the inflammation. It really does.
Dude,
like,
and
I'm
we're
telling
gonna
you
do-
right now that I told you that I did it for a brief time. My joints and everything have been so swollen that I'm back on it again. Very low dose. Like I'm not trying to lose weight.
Right.
But like I'm not even taking a dose that most people who are trying
Dude,
to
and
lose.
it's crazy.
But it's like my hands aren't swollen anymore. Like my body is like, it's just,
And it's absolutely bonkers that you said that. This is kind of proof of the simulation
Yeah.
because because
back to that.
because
Watch last week's episode.
the next segment is actually about Ozempic and joints.
Oh, okay.
Like it's unbelievable you said that.
Yeah.
So I think that Ozempic and Semaglutide is probably a 10 out of 10 on what influences. And the reason I say that is, why wasn't skinny super popular in the past? Well, because it's hard to be skinny.
It is.
It's super hard to be skinny.
I actually found a video of the girl I was talking about, if y'all want me to play it.
Yeah.
Is that okay?
Yeah,
Sorry,
sure,
Kaylee,
bring
you were
it.
going to say something. I interrupted you.
No.
No,
We'll go
bring
back
it.
to
What do
it.
you got?
The
I'm
one
ex-
that was bullying, the
Yes.
yeller? Okay,
Yeah,
I want to see
all
this.
right.
This message, keep scrolling. Your food doesn't have to taste good. You're not 5. This isn't your birthday party. You don't need every meal to be fun. Your taste buds don't pay your bills. So stop letting your cravings walk you like a dog. We do things we don't want to do every single day. If we only did what we wanted to do, we'd all be jobless, broke, and probably texting our ex like that ever ended well. If you want to stay average, then keep eating Taco Bell and blaming your thyroid. If you want to be hot, stop acting confused. You know exactly what to do. It's not rocket science. You taste food for what? 5 seconds? Letting 5 seconds of food dictate your life? You're giving up your dream body for something that makes you feel bad and look bad.
Okay, wait.
Dude, was the voice supposed to be like that? Or was I getting an echo?
I don't know why it was like that.
Okay, so
I
it's
think
not
it's
the-
something with my PC audio.
Dude, that was pure nightmare fuel. Like the way
I
that
think
her
it
voice
kinda-
was, and then she's like, it was clipping. Like I felt like she was like
That
some
account
sort of
needs
like.
to be banned, though.
Also,
That
did
was
you
like
see
a
her
s-
arm? Like her arm looked like just.
Did you see her face? Like, it's a
Yeah.
filter. It's like, okay, if you're going to be that aggressive, then show your real face.
Dude, that video freaked me
Yeah,
out.
sorry about
man.
the
Let me see your
echo.
face.
I don't know
Like,
why it did.
No. It almost like I was like, is that how it's supposed to be? Because like I feel
Honestly, I'm really
I feel like
glad
I'm
it
gonna
went
do
like
what it
that.
says because it may possess my soul or something if I don't. It was like a demon talking to me, man. I didn't like that at all, man.
Yeah, I don't like
that's-
I saw it, so I had to show y'all.
Dude,
that
that's
this-
crazy. Thanks for
and
bringing
she
that
keeps
one.
like showing up on my page of like uninterested. Like
Let's
I don't
block
like
her.
this.
I don't like you.
Let's
She's
block
coming
Be
her.
for
gone,
me.
demon. Be gone.
Yeah, I don't
Dude,
like
Not
that.
today.
That's it. Okay, she's gonna. You have to send me her name because
I
I'm gonna
will.
bring her back on the Skinny Talk. Wow.
Yeah.
That
I
was
don't know
crazy.
what to say. Other than that,
All right.
I don't really like
Next
her.
question. What
I'm
happened
sorry.
to body positivity?
What do you mean? It's still there.
Is it? Like, if everyone's supposed to be skinny? Like, that's not body positivity?
Yeah, I haven't seen it as much.
Yeah,
But
it's
also,
kind of dying, honestly. I think it is. Like,
Also, running, I feel like is really in right now.
dude,
and
I love running. That's one of my favorite
Yeah,
things
I
to do.
wish I could.
I like
There was
running
actually a girl
very
on a
little.
show that I ran, and she has, it's a company called Addison Sweets by Addison, something like that.
Oh,
but
yeah, Addison.
Yeah.
She does the gluten-free stuff.
Yeah, and she said that she is running over 5 miles every single day. Wants
Good
to
for
run
her.
like over 20,000 this year.
Yeah.
I'm like,
I got to a point
wow.
where I was doing 2 to 3 10Ks, so that's 6
but that's
point.
healthy stuff. Like,
I did a half marathon once.
Yeah,
Wow.
I did
I've
one a
only
couple
done,
months
like,
ago.
5.
I just did it to say that I did it. I never.
I did
will do
one
it
in
again.
December. I do them pretty much. Well, I haven't done the half marathon every year. I usually do marathon relay, but I'm going to do it again this year because I'm still in pretty good shape. Like, I took off once the marathon was over, which has been a couple months now. But it takes a while to lose that, so I'm going to jump. I made a thing. Is like I don't like cold. You don't catch me running a lot
Yeah.
in the winter, but when I get back from spring break, it's going to be warming up.
Yeah.
And I'm going to start hitting the miles in because my goal is to actually post a decent time for my age in the half marathon this year. So I got like 8 months or 10 months. So
Speaking of organically, Addison, just to go back to her, because I'm gluten-free and I've been gluten-free for 2 years now, and I met her right as I became gluten-free. And I've tried many of her recipes, and they're good, but I'm really bad at cooking them.
Oh, really?
She's got good recipes. Just shout out to her, but I botch all of them.
Oh.
I know. I wish I was better. That's just why
I
go
love
buy
cooking.
food.
I could talk about
Just go
cooking
buy
all
food.
day because I
yeah, she has like
absolutely love to cook.
protein brownies
Yeah.
now, and I really want to get them.
Also, if you
But
like cooking,
don't ask
I
me to
mean,
try
this
it.
is going to sound totally cliche, but AI is fantastic for being a cooking assistant. I get some amazing recipes from
Yeah,
AI.
I get banana bread recipes.
Yeah.
From,
Like
ChatGPT.
I use it. I'll bring up like I'll say, hey, I got this cut of meat or whatever. Give me 10 different ways I could cook
Ooh,
this,
that's
and it'll give me
smart.
like a 1-sentence like description, and I'll be like, okay, number 3, expand that out, and
Yeah.
then and I've used a lot of the recipes, and they're really really good.
Cool.
Yeah. So okay, all right. Last part of this. What was the last part? I mean, I guess is there anything wrong with wanting to be thin? I mean, I'm gonna answer that one. I mean,
No, there's nothing wrong depending on how far you go.
Yeah, exactly, right? Don't hit the extremes. Like, remember we were talking about Kelly Osbourne, and we don't even know that she's trying to do that on purpose.
Yeah.
I mean, she might actually be ill or something. You just don't want people to be unwell. I mean, there's a lot of documented health problems with getting too thin, like immunity and, bone strength, and all of those things are, potentially really harmful to your health when you get that thin. So, yeah, I don't know. I don't disagree that skinny culture is kind of coming back. As we talked about, like, I mean, I think that there's 2 big things pushing it. It's like Ozempic and social media. Yeah. I just wonder when dad bod's going to come back in style. Yeah. Not that I have dad bod. I'm not saying I
Bruce is
do.
waiting
but-
for that.
No, I don't know. I have a little bit of body dysmorphic disorder if I'm being super honest. Like, if I gain a little bit of weight, I freak out and I'll just stop eating. I keep my weight in check within about 5 to 8 pounds.
I feel like I've been like that until now, and as a woman in her 40,
Yeah.
40,
It
like
gets harder.
everything kind of,
Dude, it
your
gets insanely
hormones
hard.
go insane, and your body
Yeah.
just decides to just
Yeah.
not.
As you get
do what it's
older, it
supposed to
gets
do.
much, much harder to keep your weight in check. And I'm going to say doubly so for women.
Mm-hmm.
I mean, for men too. I'm not saying that it doesn't happen to men. But I think, and I probably should look this up. I think just hormonally for women, it's tougher. I don't know that for fact, but I kind of think that to be true. So, all right. Skinny culture, is it back? Well, it was in the 20s with the flappers. It was in the 60s with the Twiggies. Then we had the heroin chic of the 90s, which was kind of like my prime time. And then we had a lot of things come through. We had the Kardashian body, then recently the ballet body. But a recent article claiming that skinny is back in. And you know what? I don't think that I disagree with that. And why is that? Why would skinny culture be back? Well, you have things like Skinny Talk on TikTok, where you got these militant accounts telling you that if you don't eat that Taco Bell, or if you do eat that Taco Bell, that your whole life's going to be ruined. What's that about? Then you got things like Ozempic, which I think is an enormous driver in this new skinny culture, because in the past, it was kind of hard to be skinny. You had to really work at it. Nowadays, just take a shot. You can be skinny. We talk about it all the time. We see celebrities have gotten so thin, and they will openly say that they've been taking things like GLP-1. So is this harmful? Well, yeah, definitely. There is a point where you get so skinny that your health actually starts to decline. Not to mention, I think, just the mental health aspects that would drive someone to push their bodies to that extreme. I don't have a problem. If you want to be skinny, be skinny. It's just I want to make sure that you're healthy, and I want to make sure that you're not being pressured to do this by militant social media accounts or TV commercials telling you got to do this, or celebrities telling you got to do this. So be aware, skinny culture is coming back. I think that is true. Just we got to keep it in check. Let's keep it real, man. It's okay to have a little bit of body fat. That's normal. So all right, moving on. We were just talking about Semaglutide and Ozempic, and you mentioned your joints. Mm-hmm. Wow, that is so crazy. We've done a million segments on Ozempic. Fortunately, the majority of them have been good, I think, good. And mostly we do segments about research, new research coming out. Almost all of them have been good. Now we have one more that's directly related to what you said. This is a segment on a new study out showing that Semaglutide actually reverses arthritis. And when I saw this, I was skeptical. It's like, it's almost like they're saying Semaglutide is a miracle drug, that we need to put it in the water or something. Because, I'm almost ready to find a research paper that says something bad about Semaglutide, because they've all been good. And I've always said I like Semaglutide because of the health benefits. And I guess, if I'm being honest, this is just another one that's going to reinforce that. So I always like to show the research papers that we talk about. So Brenna, next picture, if you please. This is the research article. You can easily look this up. It says Semaglutide ameliorates osteoarthritis progression through a weight loss independent metabolic restoration mechanism. I really feel like the researchers need a bit of a branding coach like that. Yeah. I'm in the biz of looking at research papers, and my brain kind of shut off after about the third or fourth word. But if I really forced myself to look at this title, there is one very important string of words in there that really is kind of the big part to me, is weight loss independent. Those words to me are very, very important, because when I first saw the article saying that, Ozempic makes your joints better, well, duh. If you're heavy, that's bad on your joints. Yep. And if you lose weight, that's better for your joints. So I was thinking, okay, this is the dumbest thing ever. Of course, if you lose weight, your joints are going to be better. But those key words, weight loss independence, are the big ones. Because basically, that article is saying that it's not just the weight loss, that Ozempic is actually causing improvements to the joints outside of just reducing the strain. And if true, that's pretty huge. So, studies started with mice, as they often do. I don't know why are mice what people are testing?
There's a lot of them.
Always.
I guess maybe that's a good choice. You'd feel bad if it was a dog.
What about birds?
Well, how do you do it on a robot, right? You studies on robots. People that are seeing this segment and don't know what we're talking about.
Yeah, watch the last episode.
Is this guy crazy?
Last Friday.
Is he crazy? Yeah. So mice. So they started with mice. They put them on Semaglutide. They basically had one group. So they had two groups of mice. One was on Semaglutide that lost a set amount of weight. But then they had a second group of mice that was not on Semaglutide that they had lost the same amount of weight by doing exercise. Okay. So basically, I want to break this down. I want you guys to understand this because it gets muddy, and I want people to understand. You got two groups of mice. One's on Semaglutide and loses X amount of weight. The other is not on Semaglutide but loses X amount of weight by, I guess they were forcing them on a treadmill.
I was like, are they like a hamster wheel, or what are we doing
I guess
here?
So. It's like, run on this wheel or you get zipped off into the abyss. So this is a good study, though, because they, just like we said, we don't want to just be about losing weight. We want to see the Semaglutide actually improve joints. And this is a good way to test it, because you have two mice and they both lost the weight, but one's on Semaglutide. And then they looked at things like joint pain and the quality of health of the joint. And then in my brain, I was like, right. I was like, how do they know the pain level
of the mice? Yeah, that's a really good question. I didn't even think
I'd have
of
to
that.
get the
I need
actual
to
full
know.
study. I mean, I probably should look into that because now I bring it up and I look dumb because I didn't look it up. But in my mind, I was like, how did they do that?
Yeah, how did
okay,
they, like,
but the
get us a
end
rating, 1 or
result
2?
was that the mice on semaglutide that lost the same amount of weight as the mice in the other group did have decreased pain and improved joint function, which does make one believe that the semaglutide is actually improving the joints, making them better. So how would that work? Now we're getting into boring biochemistry. Trying not to put myself to sleep when I talk about this, and I'll do my best not to put you guys to sleep. So semaglutide actually improves and alters chondrocytes, which is a word I was like, yeah, I know what that is. Like, I went to med school. So chondrocytes build cartilage.
I
Okay.
learned about that in biology, I think.
Yeah, so it sounds familiar, right? These are cells that produce cartilage. And what semaglutide does is it activates a pathway which makes these enormously more efficient. I think it was 28 times more efficient at doing their job of building cartilage. Okay, so that could make your joints better. Okay, it also
It
still...
also could make them not better. Isn't cartilage bad sometimes?
I'm...
Oh no, when cartilage goes away and the bone on bone.
Yeah.
Okay,
No,
sorry.
cartilage is
I'm
good.
back.
Yeah,
I'm back.
I was trying to remember.
I
Is
had to go
like,
there.
is there like a too much cartilage thing? I don't think that exists.
I went the wrong way.
Now you might say, because I know you guys, you've been hearing me drone on about research papers all the time. It's in mice. So what? Mice don't correlate with humans. Oh yes, you are correct. However, once the researchers got the mice data, then they went on to humans in the same study before they released it. So it was 20 humans randomized into 2 groups, one with semaglutide, one that was not. They had them on 24 weeks. Now, in the semaglutide group, they had decreased pain and increased function, but they went one step further. They got MRIs of the joints to look and see what was going on, and the MRIs in the group that were on semaglutide had thicker cartilage and evidence of recent cartilage growth. So this research seems pretty legit. I mean, the biggest thing that you can say about it is that it's a small study, which is 100% true. But you have research and results in mice that show one thing, and then you have research in humans that says the same thing, and that is a big deal. Of course, this doesn't necessarily mean that Ozempic has cured osteoarthritis, but if it did, it would be huge. 600 million humans in the world suffer from osteoarthritis. Okay, number one, and that number is expected to go up to closer to 1 billion by sometime in the 2030s. This causes people a lot of pain, a lot of lost work, disability. I mean, osteoarthritis is the real deal. Like, this is one of those things that no one talks about that actually is a big problem. And now we have actually some pretty legitimate data that says that semaglutide might reverse it.
So I actually, for the last several years, work with Plain Orthopedic and Sports Medicine.
Yeah.
Do their social media. I
Yeah,
know
yeah.
a lot more about
Are they talking
orthopedics.
about this?
Yeah, so I actually just put together a post a couple weeks ago about tips because, yes, it is good for your joints, but at the same time, you have to support your joints. So
Okay.
just completely not working out or not
Right.
building muscle is not a good
Yeah,
idea.
that's the big thing they say about
So
semaglutide.
making sure
Yeah.
that you're doing some type of muscle
Right.
work along with this is
Yes,
going to
yes.
be big. And there's some other ones. You can go onto their, I just did this a few weeks ago.
Very
on
interesting.
their,
Well, you should have
social
done this
media.
segment, not me.
And then also one of the big things that some of the surgeons pointed out to me was, hey, make sure if you are on that and you do have to go have surgery with an orthopedic surgeon, you need to tell them you're on it because you have to be off of it for a certain amount of time.
Yeah,
Of course,
for
you know
sure.
that.
Yeah, that's a big one.
But yeah, I mean, it's all. I mean, my inflammation is like because I know I have like some kind of carpal tunnel or something from my push-ups and
Yeah.
my tennis and all
Sure,
of that.
tennis will do it, sure.
So it was so bad that I was asking doctors like, is something wrong with my kidneys? Like, is something wrong with any of my because like my hands would swell up, and now it's like
It's better.
better.
It's crazy stuff. Yeah, the one thing that you were mentioning about the muscle loss, because muscle, if you get too much muscle wasting, then your joints do get unstable.
Yes, they
like
do.
that's 100% true, and that is the one, not the one thing, but one of the bigger things that you need to know about if you're taking semaglutide, Ozempic, or whatever. When you start losing weight, and this is not a semaglutide thing, this is a losing weight thing, you commonly lose muscle.
Yes.
And there's a downside to that. And it's been shown pretty clearly that people on semaglutide will start to have muscle loss. However, it is very, very easy to counteract that. There's been a lot of studies on, how do you stop that from happening? Just simple resistance training will do it. Like, you don't have to like go into the gym and bust out like, 225.
I do like 5 pounds.
Yeah, that's
8
plenty.
pounds.
Yeah, that's plenty. That's all you need.
And
So-
I've started, I don't know, this is social media, by the way, at its finest. But I
Okay.
started taking creatine, like
Oh, yeah.
gummies,
Dude, I used to
help bring water into my muscles. To
I
help.
used to take creatine by I would just spoon it into my mouth.
Really?
Yeah. Well, back when I used to work out and stuff.
Yeah.
Were we talking about working out? Oh, no, that was the last segment.
Yeah.
Where I used to work out a lot and do weights. Yeah, I'd
Yeah.
take creatine all the time. Yeah, I mean, that's been hot forever. I remember back in the day in the 90s.
But I'm not trying to like bulk up.
Yeah, yeah.
I'm just trying to like
No, there's a lot
make
of people
sure
take-
my
yeah.
muscles, because I did notice that when I came off doing the shot before, when I went to work out again and lift, my muscles hurt
Yeah.
so bad.
Yeah, you
like
felt
I
weak.
could not do. It was like
Yeah,
every
you
single
lost
time.
muscle. Yeah,
and
totally.
it was stuff that I never had any problems with before. So
That all checks out.
Okay.
That all checks out. All right, well, we've done just countless segments on Ozempic and semaglutide, mostly when new research comes out about it, because it is hot. Everyone's talking about it, so we're talking about it. But I like to bring you the research and talk about what does the data show on this drug. And I have to say the overwhelming amount of research has been nothing but positive. It almost makes me want to see something negative, because it's like this is the wonder drug. It needs to be in the water almost. And we have a new research paper out, and again, positive news, this time related to joints. So it's pretty obvious that if you lose weight, it's better for your joints. But a new research paper came out that said not only does it help because you're losing weight, but Ozempic actually improves the quality of the joints by causing new cartilage growth. Well, how would it do that? Well, it actually upregulates the efficiency of chondrocytes, which are the cells that produce cartilage. And they actually did first mice studies and then human studies showing this to be true, with MRI results showing big improvements in the joints of the patients that were taking Ozempic. Now, this is just the first set of trials, but it is human trials, not just animals, which is important. This will go on to bigger trials, but the preliminary data is really good. And even my co-host Kalee said that she had taken it for that exact same reason and saw pretty big results. So I don't know. I mean, Ozempic, the news keeps getting better and better. We're going to be here to keep you up to date on it. All right. Last segment that I just flung across the table. Another sad story. Fortunately, we do a lot of sad stories. And again, we don't do these to, sensationalize them. I always try to make it as educational as possible and obviously respect to people that get hurt in these things. But sad story out of Brazil that we're going to try to figure out what happened. And it is what caused the plastic surgery death of a prominent businesswoman in Brazil. So, yeah, she doesn't need plastic surgery. What's she
looks
do?
beautiful.
She looks like a model. Wow.
Yeah.
So last week, a 31-year-old prominent businesswoman, Priscilla Dornelis, went to what was apparently a legit plastic surgery facility. And per the reports, she had liposuction, breast lift with implants, and an unnamed scar revision. She stayed at the facility overnight, which is a little weird. I mean, I wouldn't keep somebody overnight in a facility for that type of surgery. I mean, I do surgeries like that literally all the time. In fact, I wouldn't consider any of that to be, at least if it's what they say it is, like just, maybe liposuction on one area and the breast lift and breast implants. Like, that's not really big at all. And so, but they did keep her overnight. It also makes me wonder if maybe there's more to it since they did keep her overnight. I don't know. Maybe that's just common in Brazil. She was discharged the next day in reportedly good condition. Okay. Went home. The next morning, her sister came over to check on her because she hadn't heard from her, and they found her dead in her home. Now, we're going to dissect this, but I almost feel bad asking. I mean, do you guys have any theories on what may have happened to her? And that's like an unfair question to you guys because you guys do not admit. I'm just thinking, one of you guys heard me say enough stuff where you're like, maybe I do know what happened.
Maybe they left something inside, or
That would be
hit
hard.
something.
I mean, that's always a possibility.
Maybe they punctured like something where her urine was like leaking
You got
out.
a puncture? Okay, now you're on the right
Something
track.
like that.
Yeah, puncture. That's definitely something we're going to talk about. I mean, I'm asking you an unfair question. It's like,
I have no idea,
yeah.
obviously.
No.
This
And
is a
I
simulated
just
world, if we want to go back to that.
I just, we do a lot of segments because I'll end up, after you've been here a few years, you'll hear the same things over and over. All right, so I'm trying to figure out what happened to this lady because it doesn't make sense on the face, right? Because you have what appears to be a healthy patient. So that's the first thing I would want to know when someone, passed away from surgery. Are they a healthy patient? Is it a 30-year-old seemingly healthy person, or is it a 90-year-old person with diabetes and cancer and all that? I mean, she seems very healthy. She looks like she's in great shape. So healthy patient. Next thing I know is what procedures they had, okay? Because the one procedure I hate, both of you can tell me what procedure. What procedure?
BBL.
Yeah, Brazilian butt lift, right?
BBL.
Yeah, absolutely.
Especially out of the country.
Thank you, Brennan. That's very good. Because of the high mortality rate associated with that. So what procedures did she have?
This one was in Brazil, right?
It was in Brazil.
Is she from Brazil, or did she go
No, she is from Brazil.
Okay.
Yeah, she's from Brazil. So it didn't say she had a Brazilian butt lift, but it did say she had liposuction. Now, I'm gonna circle back to this because did she really have a BBL? I mean, that would explain things. But let's just go with she had liposuction, breast lift, implant, and a scar revision. I mean, to me, none of those are very risky surgeries. I mean, I'm gonna break them down one by one. Scar revision, no. I mean,
I've had that.
yeah, scar revision is nothing. I mean, that's like getting a mole removed. Breast lift with implants. Okay, a little bit more invasive surgery, but definitely very, very unlikely to result in something that would cause death. I just can't see that one. Now, liposuction is the one where there's a possibility. And I'm going to break down what type of complications it could be and see if we can come to a conclusion. So the other thing that I was going to mention is time after surgery. That is important. She apparently had some event approximately 24 hours after surgery. If it was an anesthesia complication, it would likely have been sooner. It would have been right after her surgery, which was not because she stayed in the facility. She was let go. So we can eliminate anesthesia complication for the most part, eliminate it. And that is definitely a risk of death after surgery. And the other thing is we can eliminate sepsis or infection, okay? Because it's too short.
Is sepsis like a longer, drawn out?
Yes, it's the infection. So sepsis is basically systemic infection. If you get an infection in one area, that's, an infection. If it spreads throughout your body, that's sepsis, okay? So we can eliminate sepsis because infections are most at risk at 2 to 10 days. And infection will come first and then sepsis. Like you just don't generally jump into sepsis. Theoretically, it's possible, but that's not the normal pathway. So I'm going to safely eliminate anesthesia complication. I'm going to safely eliminate infection or sepsis because of the time frame. All right, so what could it have been? The first one that comes to mind is, did she have so much liposuction that she went into basically cardiac failure? That is a real thing. When we do liposuction, we limit liposuction to 5 liters, so 5,000 mLs. So that's basically what, a gallon and a third or whatever of fat removal, because when you do massive amounts of fat removal, it actually starts to strain the cardiac system as you start to get these massive fluid shifts. Okay.
Interesting.
Now, why am I eliminating that? Because it didn't mention how much that she had to remove. I'm eliminating it because in the picture, she's too thin to remove 5 liters.
Yeah.
Somebody that's getting 5 liters removed is going to be a heavy person, or obese even, because 5 liters is a lot. And so I think I can safely eliminate high volume liposuction just by looking at her picture. Okay, did she have a heart attack? I mean, that can happen. It can, but typically heart attacks after surgery are on people who are older.
Yeah.
People have cardiac issues. So, I mean, is it impossible? No.
Might have had an underlining.
That is possible.
It's like a big thing nowadays.
Underlying heart stuff?
Yeah.
You're not wrong. You're not wrong at all. I mean, that definitely could be a possibility. Is it likely? I would say no. Okay, bleeding. So could she have bled somewhere that could have caused enough blood loss for her to die? She could. That is a possibility. I mean, you mentioned it. You were talking about, you were dancing around it, which is the liposuction punctured something. That is a possibility for sure. I don't think
in liposuction, can you nick like where your secretion would come out? Because that's what I was thinking, is not so much blood, but like, because you could die faster with that, right?
Well, and that kind of goes back to, could it be sepsis? I mean, the only way it could have been sepsis is if the liposuction punctured the abdominal wall and it maybe punctured the colon, which would release a lot of, bacteria into the abdominal cavity, and then she got sepsis and died. Okay, that's a possibility. But the reason I would say...
That takes like a couple days.
Well, that could actually go pretty quick.
Oh, okay.
That's almost like, if you heard of people lose appendix rupture and they die, that happens fast.
Yeah.
And they can go down very quickly. But if that were true, I think that would have popped up before she left the next day.
Okay.
If she punctured her colon, she maybe could have gotten out of the facility, but she would have been an extreme problem within hours.
Okay.
And she was there overnight. So now maybe like a slow bleed, I mean, possible. The time frame is what really makes this weird, because she was monitored for basically 12 hours and she was fine, and then she was dead within an hour. Organ injury is the other one, and that goes along with the puncture and the bleeding. Liposuction can puncture organs. I mean, it's even possible with the breast. If you had a big needle and you were making a stitch, could you nick the lining of the lung and cause the lung to collapse? I mean, anything's possible. That's not a that's not a complication I would talk about if somebody comes in for breast surgery.
But you would know that before you left, right?
Probably. Yeah, probably. That's, again, what makes this one weird is the time frame. She was monitored for at least 12 hours after her surgery and was fine, according to them, and then suddenly she's dead. And it just doesn't make sense. The other one that it could be would be a blood clot. Mm-hmm. When you look at what are the most common causes of surgery death, blood clot is generally number 2. Again, that one's weird because that usually happens 2 to 10 days after surgery. She wasn't really 2 days out when this happened. She was 1, so could it be a blood clot? And what happened?
When did her sister come over to check on her?
So she had surgery on we'll call it day 0. She was discharged home.
Day 1.
Day 1.
24 hours.
And she was dead the morning of day 2.
Okay.
Yeah, it's a really narrow window.
It is.
It's really narrow. The other alternative I have, which the time frame would actually follow this, is if she had a Brazilian butt lift, fat embolism can happen in that 1 to 2 day period. Now, they didn't mention she had a Brazilian butt lift, but they did mention she had liposuction. Mm-hmm. And sometimes when these reporters are getting information,
yeah,
maybe it wasn't actually described the right way. So if I had to pick one of these, and it's almost like I'm cheating, I'm saying, well, based on the information I have, the information's not right. Mm-hmm. I'm saying that something's not right here.
Something isn't adding up.
Something isn't adding up. Yeah, I do think that something is not adding up. I think that common things are common. Far away, the most common deaths of plastic surgery, at least in this day and age, is fat embolism. The most common surgery is Brazilian butt lift, which does require liposuction. I mean, that's my guess. I don't know.
I think you might be right on that.
I'm going to have to follow up on this one because it's weird. I mean, I mean, anything's possible when you have surgery. It's like flying, right?
Yeah.
I mean, if you tried to be in a plane crash in your entire life and flew every day, we did the wrist thing on it. It's impossible. But anything's possible. There's always that very, very minimal risk. And so all those things I talked about, like heart attack, blood clot, this and that, is it possible? Sure. Is it likely? No. So I don't know with this one. It's hard for me to give people any advice about this because this is a woman who did not do medical tourism. She went to a legitimate facility, nearby where she lives. She didn't have any, at least by what they're saying, she didn't have any crazy surgeries.
Yeah.
Breast lift and implants and lipo, I literally do that all the time.
Yeah.
And it's so routine. And she's young and she's healthy, and then suddenly something happens and she passes away, and it's just none of it makes sense. Yeah.
Yeah.
So I'm gonna keep a follow up on this one because I just feel like we're missing something in this.
I think so too.
Yeah. So, all right. What are the common causes of death after plastic surgery? Well, thankfully, death after plastic surgery is very, very rare. The stated risk is said to be, I think, 3 3 in a million, if I remember last time I looked, which is very, very low. Obviously, some of those patients are people who probably shouldn't be having surgery. So if you're healthy, then that risk drops even lower. But we're talking about the sad story of a 31-year-old businesswoman in Brazil who died after plastic surgery. And it's very unusual because the procedures she had are not the ones that typically are associated with high risk of death. She had liposuction, she had breast implants, and a breast lift. I literally do that all the time. It didn't say she had a Brazilian butt lift. She didn't have a tummy tuck, which is the other one that has a slightly increased risk of death. She actually stayed in the facility overnight. They said that she was doing great the next day. She was sent home, and then the next morning her sister found her dead in her house, and we were trying to break down what happened. There are risks of surgery, blood clots going to your lungs, but typically that happens later. Things like infection going to sepsis, but that also happens later. Anesthesia complications generally happen very early, and she stayed in the facility. There was a question of whether or not the liposuction punctured an organ or caused bleeding. Again, that probably would have been picked up before she left the facility. Now, I don't know what happened to this girl. It's very, unusual based on the timeline and her being so healthy and the procedures she had. I almost wonder if maybe what we're being told is not accurate. Did she have a Brazilian butt lift? That does involve liposuction, and that does carry a very high risk of death via fat embolism, which does commonly happen in the first 1 or 2 days. That does make a lot more sense, but that's not what we were told what's happened. So, not sure what happened in this case. I am going to follow up on it. It's a sad story. I always try to bring some type of information to help people when sad things happen. At this point, I just don't have enough to make any type of clear decision on that, but I'm going to follow up and I'm going to let you know. Okay.
I'm looking it up right now.
Oh, is there more information now?
Well, no, I'm just looking to see what I can find.
I mean, maybe there might
Found
be
on the bedroom floor.
Yeah, there might be more information out. Because I do these, and then the next day a new article will come out, and it's like,
When did it happen?
it was just a few days ago.
Wow.
Well, it'll be a week ago now when this airs. Yeah.
That's sad.
Yeah, it's terrible, right? And especially, you just hate to see people pass away.
She's so pretty.
From
that's
something
a
that
really pretty picture of her.
Yeah, she's gorgeous.
She's so pretty.
Yeah, she's a gorgeous woman. So, yeah, sad stuff. All right, we'll keep an eye on that. All right.
Yeah, sorry.
Thank you guys so much for tuning in. We really do appreciate it. Please crush that like and subscribe button and leave us a comment. We will see you on the next episode of Nip Talk. Bye.